Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor, and today we will discuss a topic that I am asked very often. At our Center for Medical Information, we run a program to eliminate nutrient deficiencies. And our statistics show that those who follow our recommendations always see improvements. But I am periodically asked the question of how taking vitamin A affects the development of cancer in smokers. So let's take the time to thoroughly sort out this important question today. This is necessary because absolutely all of the various pieces of information found across the internet regarding the link between vitamin A, smokers, and the risk of cancer, all of these complex topics, are actually based entirely on one single specific study. This particular research paper was originally published way back on May 2nd, 1996. And here there's quite a list of people. Doctor of medicine, doctor of medicine. There are, I don't know, probably about 10 of these doctors of medicine who conducted this study. So let's figure this out, because I want to tell you right away, if you want to drown in a swamp, you need to start reading this report, which is called The Effect of a Combination of Beta-Carotene and Vitamin A on Lung Cancer and Cardiovascular Disease. That is, they didn't even focus on smokers. They basically looked at cardiovascular diseases. Let's definitely try to force our way through right now. Through all that swamp of information that's written, and now let's highlight and focus our attention on the most crucial and significant point of this research. So we must ask, what specific kind of people were carefully chosen to participate in this scientific study? The researchers selected individuals who had been directly exposed to hazardous asbestos fibers at their place of work at least 15 years prior to the start of the study. Alternatively, they had to have a clinically confirmed positive result on a chest X-ray examination indicating the presence of lung diseases. This ensured the study group was appropriate for the investigation. Whether or not you are already aware, inhaling microscopic asbestos dust is a highly pathogenic thing. This exposure often leads to the development of severe lung diseases such as asbestosis and can eventually result in various cancer. In general, it's an extremely harmful impact on the lungs. So then after that, related to asbestos, in other words, these people either had to work in certain high-risk professions. So who exactly did they select? So plumbers, pipe fitters, a couple of mechanics from factory boiler rooms, for some reason listed together, apparently a couple of mechanics from factory boiler rooms, not ship boiler rooms, ship electricians, ship cleaners, insulators, and drywall workers. Individuals employed as cardboard or sheet metal workers. Specifically those who have historically worked with hazardous asbestos. So it was required that these people had to have a history of at least 20 pack years of cigarette smoking in their lifetime. Now pay attention to how they formulate the statistics. It's unclear how many cigarettes each of them smoked on average per day. 1 or 2 packs? What exactly does 20 pack years of smoking mean? So here we're already starting to connect the dots. They could have just written, on average, these people smoked a pack of cigarettes a day. Then everything would be clear. So what was the age range? The age range from 45 to 74 years old. Again, that's quite an age range, wow. Well, 45, obviously, is an age that's really oncogenic. 45, well, 74, yes, that's really quite an age. So what do we find? So at the very beginning of this study, they present the conclusions. Apparently, so that people reading it, since everything is tied together here, go straight to the conclusions. And the conclusions are right there. Let's look at the interesting conclusions. On average, after 4 years of taking a combination of beta-carotene and vitamin A, there was no benefit. And possibly, it may have had an adverse effect on the incidence of lung cancer and the risk of death from lung cancer. Do you sense the wording? It may have had an effect, or maybe it didn't have an effect. So, regarding the risk of death from lung cancer, cardiovascular diseases, and any cause, both smokers and workers exposed to asbestos. In other words, here again we run into the issue of wording. Can you imagine if they had written it differently? On average, after 4 years of taking the combination of beta-carotene and vitamin A, there was no benefit and possibly no adverse effect. Do you understand? It may have had an adverse effect, or it may not have had an adverse effect. It's the same thing, but now it's said with a different nuance. But then comes this incredibly dense and viscous study, which, if I am being completely honest with you, I think was carefully designed so that no one would ever actually read it. Because as you begin the process of reading it, your eye suddenly and unexpectedly catches on some very interesting and revealing data. So they gathered all these different people together, and there were quite a lot of them, right? They came from these various factory boiler rooms, not the ship ones, including many skilled ship electricians, spanning the long period from 1945 all the way to 1974. And they don't even say how many people there were. They counted them in person years of observation. What does that mean? 73,135 person years of observation. That's the kind of statistics they have. It's unclear how many people there actually were, but... So we have here a high-risk group for lung cancer. That's clear, right? We figured out that these were serious working professions, and as for how much they smoked, it's not exactly known, but roughly about a pack of cigarettes a day. And of course, these people are in the risk group for lung cancer, and the average statistics for such groups are well known. That is, you take the statistics, calculate them, and of course, even before the study began, they had an approximate number of people who were expected to develop lung cancer. And now look, here's what's interesting about what they write. They had cases, so they conducted the study from 1983 to 1995, over 12 years. And during that time, 388 people developed lung cancer. So they took people, smokers, workers exposed to asbestos dust, heavy laborers, workers in specialized demanding jobs, serious smokers, yes, over 12 years. They observed them, and among them 388 participants. People developed lung cancer over 12 years. But what happened next? They write in the section on lung cancer incidence. Specifically, these 388 participants actually represent approximately 79% of the total number of individuals who, according to our detailed statistical plan, had been originally projected to develop lung cancer by the end of the intervention. So they had over 12 years, 388 participants, which is 21% less. In other words, they had 79%, which is 21% less than they had planned for. That is 1/5 less. That's quite a drop. A 21% decrease in the statistics. Can you imagine? This is written in the section, well, here on page 6 in the general flow, well, the incidence of lung cancer. Next, what are we looking at? There's a very interesting phrase tucked away in the discussion section. In the preliminary analysis of serum beta-carotene levels during active treatment, in other words, when they give the vitamin, they call it treatment. So, in the preliminary analysis of serum beta-carotene levels during active treatment, we were unable to find confirmation of the hypothesis that subjects with the highest serum beta-carotene levels are at greater risk of lung cancer or death from cardiovascular causes, cancer, or any other cause. That's what they write. But in the finalized research results, they explicitly state that it is possible that the vitamin had an adverse effect. Why? Because here, of course, there is an absolutely devastating phrase. After 173,135 person years of observation, in the active treatment group, the incidence of cancer was 28% higher than in the placebo group. Overall mortality and mortality from cardiovascular causes were higher by 17 and 26% respectively. Absolutely all of their research, when they gave people vitamin A and when they observed them, Their research findings clearly demonstrated that the cancer rate significantly decreases with the regular supplementation of the vitamin. But then they went ahead and simply wrote down this specific statistic, which is completely unsubstantiated and not backed up by anything at all. Nowhere in any official records is it actually stated that, excuse me, when your scientific study lasts for a full 12 years and you have all these different people participating right here, there are people aged 79, 74, 86 years old. These are smokers, some of them heavy smokers. 20 people, pack years of smoking or whatever it is. How much is that? A pack a day, 2 packs a day. How many of them live to that age, right? So basically, they just pull this statistic out of nowhere, like a rabbit out of a hat. There are no autopsy results for these people. There is no mechanism explaining how a vitamin could have led to such statistics. It's just statistics pulled out of nowhere. Because when they observe, they write to us that 388 participants represent 79% who, according to our statistical plan, should have lung cancer. You have a drop. You were supposed to have 100, but 79 got sick. You have a 21% decrease. However, it is important to note that vitamin A typically has a biological half-life within the human body of approximately 9 full hours. After 18 hours, forget that vitamin A was ever in your body. That's it, less than a day. What was that? So it also says here that they stopped. They stopped the study 21 months earlier. Why? It's unclear. Something there made them uneasy. Apparently it was the fact that the cancer rate was dropping. And if they stopped the study 21 months early, then when they collected the mortality statistics, which were higher, was it after those 21 months? Right? After 21 months. Right? Based on these results, it was stopped 21 months earlier than planned. And this statistic you have, did you collect it at the end? Then what does vitamin A have to do with it? When you have, people who smoke 20 packs, years of smoking, those who are advanced in age, or who work in physically demanding occupations, and who have been exposed to asbestos dust. And vitamin A is completely eliminated from the body within 18 hours. Let's take a look at who conducted this study, who commissioned it. It was commissioned by the American National Cancer Institute, which basically receives funding from the government. It's a government institution, right? Let's look at the cancer statistics in the USA. So this National Cancer Institute has existed since 1937. In 1975, the cancer incidence in the USA was 3.7 million people. In 2022, it was 18.1 million people. And in 2026, the forecast is 26 million people. So you see, the National Cancer Institute has existed for almost 100 years now. But the cancer statistics just keep rising and rising like yeast. We take a study where it clearly shows that in your active research, vitamin, by a total of 21%, effectively 1/5, you have now a reduction in cancer. When you talk about the preliminary analysis, during active treatment, we were unable to find confirmation of the hypothesis that subjects with the highest levels of beta-carotene in the serum are at greater risk of lung cancer or death from cardiovascular causes, cancer, or any other cause. So you couldn't find it, but you just destroyed this study by burying it in unclear data with some random statistics without even saying when exactly you took them. You stopped your study 21 months early, but when exactly did you collect the data on time after 21 months? And what does vitamin A have to do with it? It should be noted that the National Cancer Institute also takes money from pharmaceutical companies. For example, one of their donors, someone who gives them money, is Johnson & Johnson, a company that produces cancer drugs. And the cancer rates, just look, they're skyrocketing. In 1975, it was 3.7 million. In 2022, 18.1 million. And by 2026, it will be 26 million. They are projecting 26 million. I can say that this is not science at all. As I understand it, this is what it's called. A biased study. What is that? That's not a study. When you need to answer the question, what is science? You're faced with a question and you conduct research to find the answer. And when you find some statistics, you need to understand why it's happening. You need to understand the mechanism, because where is at least a brief summary, autopsy data of these people when the statistics increased? Where is the autopsy data? What are the reasons? What is it? There is absolutely nothing. It's just made up out of thin air. And what is real science? And you open it up and suddenly you have, oh, something worked out, but what exactly did we get? We need to understand, we need to describe the process, we need to understand how it happens. There is nothing in this study. When they looked with their own eyes at people who actively take vitamins, all their statistics improved and they couldn't get around that. But they buried it under some completely unreadable sentences, some convoluted phrases, and you have to fight your way through it. And then you took some statistics from somewhere and you didn't even think, why is that? What kind of statistics are these? Why was everything going well and then suddenly, boom, everything dropped to 2? And most importantly, what do vitamins have to do with it? Now let's take a closer look and understand exactly what cigarettes are made of. And why, for example, these cigarettes actually function the way they do in our world today. They are one of the possible causes of morbidity, cardiovascular diseases, heart attacks, and so on. Cheap cigarettes are known to contain a substance referred to as coumarin. Since cheap tobacco, as I understand it, is unpleasant. And in order to give it a more or less acceptable taste, they add this coumarin additive. Coumarin, for example, there is a certain vodka banned in the USA, I think it's called Zubroka or something like that. It's kind of greenish, green in color. Coumarin is a substance found in grass. If you mow the lawn, that smell of freshly cut grass, that's coumarin. And that green color in Zubroka, that's coumarin. And so this Zubroka is banned in the USA because of coumarin. What does it do? It causes a deficiency of vitamin K2. What is a vitamin K2 deficiency? It's bleeding. Therefore, people who smoke cheap cigarettes, it's precisely this effect. This coumarin causes them to develop a vitamin K2 deficiency. That's bleeding. Naturally, of various kinds. These include heart attacks, strokes, and any other types of bleeding. What is a vitamin deficiency? We've already discussed this. Vitamin A is responsible for the integrity of the epithelium. Epithelial cells line the skin, epithelial cells line the bronchi, and the inner lining of blood vessels is also made up of epithelial cells. When does a vitamin deficiency occur? This epithelium starts to slough off. If you've ever seen, well, I don't know, an old pipe with peeling paint coming off like this, that's exactly what the inside of a blood vessel looks like. Its epithelium cracks and peels in the same way. Do you understand? What is a smoker's persistent cough? It's a vitamin A deficiency. The integrity of the bronchial lining is destroyed, causing constant irritation. And that's where this persistent cough comes from. And naturally, if there is constant tissue rupture, it becomes an entry point for infection, and our body tries to deal with it. It tries to break it down. This is our embryonic antigen. It's produced, we've already discussed this topic with you, yes, in the context of the oncology mechanism. Here it is. And since the physical body is significantly weakened, primarily because usually people who smoke heavily don't really want to eat much, right? So, as a result, these are also individuals who are often very poorly nourished and physically frail. And so here we have a total vitamin deficiency. Vitamin A is almost always linked with a deficiency of nicotinic acid, and a deficiency of nicotinic acid leads to tissue overgrowth. There you have it, cancer. I'll say it again. Vitamin A is eliminated from the body. Its half-life is 9 hours, and the full elimination period is 18 hours. After 18 hours, forget about it. That's exactly why you can't stock up on vitamins for life. They're a consumable resource. One of the mechanisms for the development of vitamin deficiencies is increased consumption. Therefore, smoking leads to increased consumption, and it results in vitamin A deficiency, and most likely even the vitamin that was given. Most likely, first of all, it did not cover this increased consumption. Secondly, nowhere is it stated at all whether these people were pellegrins. Whether they had a deficiency of nicotinic acid is not mentioned anywhere at all. How they ate is not mentioned anywhere, nor whether they followed a proper work and rest schedule. It's not mentioned anywhere at all whether they consumed alcohol, because I will never believe that pipe fitters, assistant locksmiths, factory boiler workers, non-ship boiler workers, ship electricians, ship cleaners, insulators, drywall workers, and sheet metal workers don't drink alcohol at all. Well, I just don't believe it. Drinking alcohol is automatic pellagra always. If you drink alcohol, you absolutely need to take nicotinic acid because it's always necessary. Because alcohol causes this. A deficiency of vitamin B3, a deficiency of vitamin B1. Therefore, when we look closely at this comprehensive study regarding the specific vitamin, the claim that it somehow negatively affects oncology patients or somehow causes significant harm to long-term smokers, it simply does not stand up to any form of scientific criticism or rigorous scrutiny at all. More likely, since they have it here, we assume it is possible, and I can also say that it is possible. It is entirely possible that this was a carefully commissioned research study, designed specifically with a certain predetermined outcome in mind. And to this whole list, people, doctors, medicine, it was necessary to adjust the data. They drove them. Because there is no science, no mechanism in their research. How? How? Explain how. Because everything you said, everything is fine. They could not find confirmation of the hypothesis that subjects with the highest levels of beta-carotene in their serum are at greater risk of lung cancer or death from cardiovascular causes, cancer, or any other cause. Well, it just isn't there. Well, this is their study. Here it is. There's nothing there. Well, if you need it, we wrote it down. When did you take them? I'll say it again. After 18 hours, that's it. Forget about vitamin A. Whatever you saw back then. If you really want to know, if you truly want to know more about the details of vitamin A deficiency, or perhaps about nicotinic acid deficiencies, then please, you must understand the underlying mechanism, because this is simply not real science, because there is absolutely nothing scientific happening here. There is something fundamental that they just can't explain. They don't explain their complex statistics to anyone at all. They don't provide a mechanism because a real scientist, a real doctor, unravels the mechanism, how it actually happens. So please read Lepsky, it's like poetry. He explains how all of this happens in the body. And when you apply this data, you see the involution of these symptoms, that is the disappearance of these symptoms, and you understand, yes, that's exactly how it works. But how do you apply this? We don't have this, we don't have that, we don't have the other thing. But in general, all of this is bad. Why? No reason. Because the National Cancer Institute told us to do it. To put it simply, having a broad range of knowledge makes a person much more stable throughout their life. This kind of knowledge, and especially the specific knowledge related to essential nutrients, is absolutely vital for our well-being. That's the conclusion. There are very few people left, including medical doctors or trained professionals, who still remain on this planet and are truly able to reason effectively. And for someone who communicates with a doctor, with a person who can reason and build this chain and knows what is happening at every moment on this chain and can explain it, that is a great blessing. I can say that those who come to us are very fortunate because this is exactly how we work. Because we do not base our conclusions on some unclear, randomly sourced statistics. Because here, it is also not stated what other illnesses these people had or what medications they were treated with. There is nothing stated here at all. This is very superficial. It is very shallow. It is a very unprofessional study that did not answer any question at all, except that taking vitamin A reduced the incidence by 21% when they administered it. Cancer incidence. That's what they showed. But for some reason, what did they put in the results? It's completely unclear what statistics they used. But this study showed that vitamin A saved 21% of people from cancer. That's what this study actually demonstrated. Come and address your deficiencies. Come. The good thing is that globally, you only need to eliminate nutrient deficiencies once in your life. And in the future, if nothing extraordinary happens, then it's more of a support scheme. And that's all. Because you need to know the mechanism, you need to know how the body works, you need to understand. And it is a great happiness when you communicate with a doctor who understands. Thank you for your attention. All the best.